Uh, we are continuing with our discussion about echocardiology, and today's discussion is about the heart valves. You know very well that the heart valves are classified into two: the anterioventricular valves, atrioventricular valves, which is mitral valve, and tricuspid valve. These are the valves which create a path through which the blood passes through from the atrium to the ventricular. And that is the reason why they are called atrio for atrium and ventricular for ventricle. Then the other type of valves is semilunar valves. Semilunar valves are aortic valve and pulmonary and pulmonic valve. These valves, they are the pathway for the blood to come out of the heart. The mitral valve, you can see them there, how they looks like. Now, the mitral valve has two leaflets. It is located between the atrium and the left atrium and the left ventricle. So this one handles an oxygenated blood. The two leaflets are handles oxygenated blood. So the two leaflets are anterior mitral valve leaflet and posterior valve leaflet. Anterior leaflet is longer than the posterior leaflet, and this one is always visible as it flaps in an echo. You see it flapping on the shorter one. So the leaflet are linked by a thin epithelium, which is a continuation of the endothelium of the heart. So the mitral valve subclavicular apparatus, it is made of condyli, condyle tendini, papillary muscle, annulus or annulus fibrosa. Now, you can see the way it is the anterior lateral commissures, the left anterior, the left anterior, the annulus anterior, the papillary muscle, the condyle tendini, which are the fibers which support the valves from the papillary muscles. You can see how it looks in a echo. You can see that the anterior mitral valve is longer than the posterior mitral valve, so it flaps on it. And sometimes it bends like a hockey stick. Sometimes that's pathologically. That is pathologically, it bends like a hockey stick. So the mitral valve in the apical chamber, the mitral valve in a apical chamber, which is the apical chamber is the best. Apical chamber is the best for visualizing a mitral valve. So the mitral valve, you can see the anterior is longer than the posterior in a four-chamber view. Later on, we will discuss on how to get four-chamber view, apical four-chamber view. We will see that one as the next discussion. So you can see the posterior, the anterior. You can see it has in echo the mitral valve is said that it has the fish mouth appearance. You can see the mitral valve anterior leaflet, the intraventricular septum. The intraventricular septum is the one which is separating the two ventricles. Then you can see the mitral valve posterior leaflet. This is the real mitral valve that it looks like. You can see that's a cross section of the heart. You can see that it has the left, the leaflet anterior, the annulus posterior, the leaflet posterior, the left atrium wall. You can see the condyle tendini, the papillary muscles, how they are holding it in a position. So let us see the tricuspid valve. It has three leaflets, that is the septal, anterior, and posterior. Anterior and posterior leaflet are always seen on echo. Usually, leaks regurgitate is normal in most people. They have what we call travio. trivial regurgitations, which is very normal. They have a mild regurgitation located in between the right atrium and the right ventricle. The tricuspid valve acts to prevent backflow of blood from the left ventricle to the atrium. The tricuspid valve, how it looks in a four-chamber view, you can see that the four-chamber view is the best for visualizing mitral valve. And this one now, it's again, you have to use it again to visualize a tricuspid valve. Tricuspid valve, you can see there is the intraventricular, septum, left ventricle, tricuspid valve, right atrium, left atrium, intraventricular septum, mitral valve, and left ventricle. This is how it is, and exactly the same one here. It is very well visible in this four-chamber view, or in four-chamber view. Epic. The apical window for chamber view. This one is very vast, which you can see the intraventricular septum there. You can see the left ventricle, which is big, left ventricle, which is small, and you can see the tricuspid valve reflex. You can see the anterior reflex. You can see the atrium, you can see the interseptum, the atrium, the posterior wall, mitral valve of left atrium, how it is. So our interest is the tricuspid valve. It is here in a four-chamber view, in a four-chamber view, a pick of four-chamber view. This is the time you can be able to visualize tricuspid valve. This is how it is. You can see the aortic valve. Now we have the aortic valve. You can see the tricuspid valve, and also you can see the mitral valve, how they are alike, how they look alike. We have the medial perspect, the lateral perspect, the annulus, the posterior septum of the tricuspid valve. You can see how it looks that when it is magnified. Then we have aortic valve. The aortic valve is located on the left side of the heart. It is a semilunar valve. It has three cusps. Cusps are named from the coronary arteries arising from the cusps. So the right coronary cusps is where the right coronary artery arises from these cusps. And the left coronary cusps is where the left coronary artery arises from these cusps. And then there is non-coronary cusps. See them now? And now, you can see the left coronary artery. You see that very well now. You can understand that the artery, the coronary, the heart get blood supply for its tissues from aortic valve, coronary arteries, which originate from there. That one is very important when it comes to the pathologies of the heart. You can see the right coronary cusps, annulus, coronary ostium, right coronary artery, non-coronary cusps, and commissures, and left coronary cusps. The aortic valve reflex. You can see the aortic valve reflect on echo. The left valve reflect on echo. The right coronary cusps, the left coronary cusps, and non-coronary cusps. The aortic valve anatomy, you can see it very well, how it looks in aortic valve reflect. You can be able to see those things very well in apicodry chamber. So the valves have some pathologies. Mitral valve can stenosis, Mitral valve can regurgitate, mitral valve can prolapse, and also can have vegetations and tumors. Aortic valve can stenoze, can regurgitate, can have congenital abnormalities, and also can have vegetation, and also can have tumors. Tricuspid valve can regurgitate, tricuspid valve can stenoze, tricuspid valve can have congenital abnormalities. Pulmonic valve can regurgitate, stenosis, and congenital anomalies. So basically, those are the valves of the heart, and we have discussed mitral valve, aortic valve, and tricuspid valve, and pulmonary valves. Thank you for listening to this lecture. Thank you very much.